Greetings to Dr. Elexson and examiner. I am Maisarah Filza Az-zahra Binti Fadilah with the metric number of 66552. Today I am going to present my final year project 2 with the title of Assessment of Food Handlers Compliant to Personal Hygiene Practices in Food Outlets in Kuala Penyu, Sabah. Now we are moving to the first section of this study, which is Introduction. This study closely related to food safety. Food safety can be defined as a prevention of foodborne disease while preparing, handling, and storage of food. This study conducted in Kuala Penyu, which is a small district located in Sabah, Malaysia. In this study, observational checklist and random sampling method was used. The data was analyzed by using SPSS and descriptive analysis. Next, we are moving to problem statement. There are two problem statements in this study. First is no research conducted on assessment of food handlers in food outlets in Kuala Penyu. Second, food handlers in Kuala Penyu are still unaware of food safety and regulation. Objective of this study to evaluate food safety practices among food handlers in Kuala Penyu, Sabah. Second, to evaluate personal hygiene and unhygienic behavior among food handlers. Third, to assess food handlers' compliance to SOP for COVID-19 outbreak. The first part of methodology is study area. The study conducted in Kuala Penyu, Sabah, located in Nillian Peninsula. Second is study design. There are two study design. First is a quantitative cross-sectional descriptive study. Second is random sampling method. For the data collection, data collected by using observational checklist from April and May 2021. 200 food handlers were assessed in this study. Regarding to ethical consideration, approval got from Faculty of Research Science and Technology of UNIMAS, and confidentiality of respondent were guaranteed in this study. For the data analysis, data was analyzed by using SPSS and descriptive analysis, and the data expressed in frequency and percentage distribution table. There are three parts highlighted in literature review. First is personal hygiene of food handlers. So in food industry, personal hygiene is significant to prevent foodborne disease. Food handlers have the potential to contaminate food while handling food. Next is relationship between HACCP with food safety. HACCP is a race-based method for prevent food contamination. By using HACCP, food industry can better assure that the products are safe. Next is food supply chain and SOP during pandemic COVID-19. World Health Organization developed two main guidance in order to support food supply chain. They also develop SOP and condition according to staff awareness in food companies. Now we are moving to results and discussion. In table 1, it shows socio-demographic characteristic of food handlers. The highest age range of food handlers is between 26 until 35 with a percentage of 55.5%. Most of food handlers are female with a total of 121 while male are 79. More than 50% of food handlers are not attending any food handlers training. Poor food safety awareness was linked to various characteristics including poor attendance at food training program. A total of 157 food handlers are not getting typhoid injection. Typhoid injection is important to prevent and control the spread of foodborne illness. Now we continue with table 2, which is assessment of food handler attire. More than 80% of food handlers compliant with food handler attire according to Food Hygiene 2009. However, 108 out of 200 respondents are not using disposable gloves while handling food. Hands of food handlers can serve in the spread of foodborne disease. Regarding to table 3, personal hygiene practices of food handlers, 94% of food handlers have clean and short fingernails. Microorganisms are more prone to collect underneath long, unclean fingernails. Only 0.5% of food handlers are having exposed skin infections and skin diseases such as eczema. In table 4, it shows personal unhygienic behavior of food handlers in Kuala Penyu, Sabah. More than 90% of food handlers know chewing, coughing, sneezing, or blowing their nose while handling food. Then, 171 of food handlers are compliant with not touching food with bare hands. According to the study by Akabanda et al. 2017, Staphylococcus aureus isolated from food handlers' hand can cause food contamination. Regarding to Table 5, Standard Operating Procedure for COVID-19 in Food Premise, 85.5% food handlers are conformity with customer number control and social distancing. According to the study by Gunnar et al. 2020, social distancing is designed to reduce interaction between people in the community. 183 of respondents were providing QR code of Maisarah or a book to record customer personal information. In conclusion, food handlers in Kuala Penyu are compliant with the food safety based on Food Hygiene 2009. However, up to 10% of food handlers in Kuala Penyu are still lack adequate knowledge of food safety and regulation. Food handlers in Kuala Penyu apply good personal hygiene practices and more likely to comply with SOP practices because of COVID-19 outbreak. The study recommends authorities to conduct inspection in food outlets to ensure that food handlers are following the law. Other than that, authorities should also enforce food safety law more strictly to ensure that food workers are completely understood about the regulation and circumstances. I would like to express my gratitude to all lecturers of Faculty of Resource Science and Technology, especially my supervisor, Dr. Elexson Nillian, our course coordinator, Dr. Binti, my academic advisor, Prof. Dr. Kasing Anak Apun, and Prof. Dr. Awang Ahmad Salihin bin Awang Musaini. This is my list of references. That's all from me. Thank you.